Hello everyone, I'm Urologist Erdem Akkaya. Today I am going to tell you about a peptide called PT141. It is characterized by increasing potency and improving the quality of erection. PT141 belongs to the family of pro-opiomelanocortins, which is a peptide family discovered and then studied in the 1960s. The distinctive feature of this peptide is that it increases sexual stimulation from the brain to the penis. In other words, it does not increase the amount of nitric oxide in the penis like Viagra and Lifta. It does not act like a phosphodiesterase type 5 inhibitor. It improves sex drive and erectile dysfunction by enhancing signals from the brain to the penis in a completely different way. It is a peptide that has only recently been used in the world. The history of this peptide is actually as follows. After the pro-opiomelanocortin family was identified in the 1960s, some peptides were separated from it. Two peptides called melanotin I and melanotin II were obtained, which cause biochemical tanning without going to the sun. After using these peptides in humans during treatment, it was found that sexual performance increased. In studies on melanotin II, it was found to increase potency in 17 out of 19 men. However, when nausea was noted in 25% of the men, the studies were terminated. Since the side effect profile is very high at 20 to 25%, this compound cannot be used. As a result, PT141 was synthesized from this peptide family. The tanning effect of this PT141 is much lower, the nausea effect is much lower, but the erectile force enhancement effect is better. Studies have shown that it increases sex drive, libido and erectile function in both men and women. In fact, it can be said that it is the only drug accepted by the FDA in the world for female loss of sex drive. It is recommended to be used 8 times per month, 1 time per day in female sexual reluctance. This is the only accepted drug. In the study conducted on it, it showed clear superiority over placebo. It was found to have a positive result of about 65%. But of course, female sexual reluctance is a very profound problem that cannot be solved with a simple drug. The couple relationship has to be evaluated. We have already talked about these details. We have talked about female sexual reluctance, that is a very detailed topic. But the FDA supports companies on this issue, frankly, because there are hardly any drugs on the market on this issue. PT141 treatment can be used for people who do not respond adequately to Viagra, or it can be used in conjunction with it. There is also a study on its use in men. However, its use in men has not yet been approved. When it is used together with Viagra or Lifta, a much stronger effect can be achieved. Apart from that, the comments on the internet are interesting. Internet comments express the desire to use PT141 only on special days. This is because it is not an oral tablet like Viagra and Lifta. It is used as a subcutaneous injection or there are nasal sprays. But the products that are sold for men are not legal. It is produced in underground laboratories and sold illegally. But as I said, PT141 could be a competitor for phosphodiesterase inhibitors in the future, especially if an oral form is found. Or it can be used in patients who do not respond adequately to Viagra and Lifta. I am talking about men here. But of course, there is no legal form in Turkey right now. But I think there will definitely be new developments in the future regarding this form. Because it is an alternative treatment mechanism for erectile dysfunction to Viagra. Apart from that, PT141 is generally this. Thank you very much for listening, best regards.